talk a little bit about vitamins after weight loss surgery. Which vitamins do I need? How important is it? And what happens if I don't take them? These are all some questions that people have asked me over the years. Let's start with Roux-en-Y gastric bypass or mini gastric bypass and think about what vitamins are important to take. First off, let me say that it is important to take the vitamins, especially after Roux-en-Y gastric bypass or mini gastric bypass. There are some very well-defined and well-known vitamin deficiencies that can and do occur if people don't take their vitamins. The most common of these are basically three. There is vitamin D deficiency, there's vitamin B12 deficiency, and there's iron deficiency. And each of them causes slightly different things, but together they all cause fatigue as their primary symptom. So how many of us already have low energy or fatigue? Let me tell you, adding these vitamin deficiencies can really take the wind out of people's sails and make them feel very tired. So if you're feeling some of those symptoms of having loss of energy and fatigue, you may want to have these vitamins tested. Even if you haven't had weight loss surgery, vitamin D deficiency is something that many people do have, and it is related in part on diet and is related in part to sunlight exposure or lack thereof, because the sunlight converts the inactive form of vitamin D into the active form of vitamin D. So if we don't get enough sunlight and we don't get enough vitamin D in our diet, then we may be deficient or low in vitamin D and therefore experiencing fatigue, but also bone loss and demineralization of our bones. So after weight loss surgery, we have these three important vitamin deficiencies that we need to avoid, and so therefore they need to be supplemented. What we recommend is a supplement that involves a good general multivitamin with iron, supplemented by an additional sublingual vitamin B12, and in addition to that, a vitamin D that is usually combined with calcium together. Now you might say, why don't they just put all those in one tablet? And the answer seems to be that they can't all be successfully compounded together into one tablet or vitamin. Also, the absorption of vitamin B12 and D is a bit different than that of the general multivitamin. So we end up having these three separate vitamins that are the key ones that everybody should be taking. There are some additional deficiencies that can occur, but these are much less common. For example, in a few people after gastric bypass surgery, they may develop deficiencies of other B vitamins. This is much rarer. We don't routinely test everyone for these as often, but probably annually or perhaps semi-annually people should have testing for the other B vitamins, the symptoms of which can produce neuropathy or weakness, sometimes in the legs, sometimes in other parts of the body that involve motor function. I've seen people with speech weakness and people with limbs that became weaker because of the neuropathy associated with vitamin B deficiencies. These were easily correctable once the problem was diagnosed. So that's really the most important thing to remember about vitamins and gastric bypass surgery, either mini gastric bypass or loop gastric bypass or Roux-en-Y gastric bypass. It's also important to have these vitamins tested regularly, because sometimes people are not taking enough, or they may forget, or they may not be taking them as often as they think they are, and we find that they're in fact becoming quite deficient and need to be supplemented even more. Sometimes people need to take extra iron, for example, or extra vitamin D, both of which are somewhat common. There are a few people who can develop profound iron deficiency and become anemic or have a low red blood cell count. This can happen in people who've not had gastric bypass surgery, but it's more common in people who have had gastric bypass surgery. A few of whom can even require infusions of the iron, and a few of it even need blood transfusions in some cases. So it's important to try to prevent that, test them regularly. We do a every 3-month test of the vitamins during the first year after gastric bypass surgery, and then a bit less frequently thereafter. But whether you're having that done by your primary care doctor or an endocrinologist or another specialist or by the bariatric surgeon in his or her office, it should be done regularly, and you do need to keep on top of that. For the other procedures, namely the gastric sleeve procedure, the sleeve gastrectomy, and for the lap band procedure, the concerns are a little bit different. Let's start with the sleeve procedure. Here the vitamin deficiencies are far less common. We do see some B-complex deficiencies and we do see some iron deficiencies, but this is much less common than it is after true gastric bypass surgery. And that's because there is no true bypass of the portion of the stomach and the duodenum and some of the small intestine. Instead, what we really have is just a reduction or removal of about 75 or 80% of the natural stomach. so that it is changed into a kind of a long, slender, tube-like or banana-shaped stomach configuration. And so all the vitamins generally are absorbed just about as well. But we do recommend a general healthy multivitamin with iron. For women, they probably should consider taking calcium and vitamin D supplements as well, just on general principles. And we do recommend regular testing, particularly of the iron and the hemoglobin and the vitamin D over the long term. For lap band patients, there's no removal of tissue, there's no removal of the stomach, there's no bypassing of the absorptive surfaces of the stomach or the duodenum or the jejunum. And so we really don't see much in the way of vitamin deficiencies beyond the rest of the population, except what occurs from reducing one's calorie intake and altering one's diet. So here again, we do recommend taking a good chewable general multivitamin with iron. And in cases of women, should be taking vitamin D and calcium supplements, again, just on general principles to avoid the vitamin D and calcium deficiencies and bone demineralization or osteopenia, osteoporosis problems that we see so commonly among women. So in a nutshell, that really describes what the vitamin and mineral concerns are. They're not too daunting. It's generally quite easy to supplement with vitamins after weight loss surgery. I tell almost all my patients that they will very likely stop taking other medications that they've been using to treat other conditions, such as painful joints and bones and heartburn or reflux disease or diabetes or high blood pressure or high lipids and cholesterol. Sometimes they can throw away a lot of those medicines, but then they do need to start taking some regular vitamins and minerals and take them for the long term and get those levels tested periodically.